So I'm going to talk to you today about managers or mentors or apprenticeship support responsibilities. So this is for the person that directly supports the member of staff completing an apprenticeship. So the components of any apprenticeship have changed slightly now. So the components consist of a set of apprenticeship standards, maths and English at either level 1 or level 2. Potentially, if healthcare, then obviously the care certificate, and also a diploma could be added on to the components within any apprenticeship. Within healthcare, the components are the apprenticeship standard, the care certificate, maths and English at level 1 or level 2, and of course the endpoint assessment requirements. So the core standards for the level 2 healthcare apprenticeship are communication, health interventions. I'm not going to read them all out, but you can see on the slide of obvious topics and potentially very familiar topics to you as managers or mentors or apprenticeship leads. So the core standards for level 3 are slightly different in that the apprentices on the level 3 qualification get to choose a pathway. So that's a choice between theatre, adult nursing, maternity, mental health, childcare, etc. So more often than not, the two most popular are theatre and adult nursing, but of course the other options are there as well. So the behaviours we expect to see or develop for these apprenticeships, which is something that you support, is there on the screen. Self-awareness, empathy, being adaptable, discreet, and obviously dignity and respect. Most of those are behaviours displayed through completion of the care certificate, through completion of a workplace induction, through existing skills and or any other qualification that they may have completed or go on to complete. As part of this apprenticeship, we would look to see the apprentice exhibit these behaviours before progressing them into any kind of endpoint assessment. So, as I mentioned earlier, they will be expected to do their maths and English if they don't already have maths and English. So, at the level 2 apprenticeships would be expected to complete level 1 in English, and the level 3 apprenticeships would be expected to complete the level 2 in English, and that consists of 3 different modules that we positively encourage managers to support. And equally with the maths, there are 2 assessments. So one would be a calculator assessment, one would be a non-calculator assessment. And again, the level 2 apprentices would look to complete level 1 maths, and the level 3 apprentices would look to complete level 2 maths. That is, if they haven't already got a valid exemption. And the tutor will talk to each learner individually about valid exemptions. That consists of, at some point during the programme, sitting an online test, which does require an invigilator. And quite often managers, mentors, senior people will happily get involved in invigilation. So that might be something that you are willing to support and can support from a resource perspective. As an example, the maths assessment is a 60-minute assessment. So we would look for somebody to support the invigilation for about around 90 minutes in a private location in the hospital. But that isn't mandatory. That is just something that often managers and mentors, apprenticeship leads do often want to support, because it makes the learner feel much more at ease when they're being invigilated by somebody they're familiar with. We do expect managers and anybody involved in the apprenticeship to support the learner with the 20% off the job requirements. Now, this doesn't necessarily mean you have to release your apprentice for 8 solid hours if they work a 40-hour week, for example. What we look to do is support you with what is 20% off the job. So typical examples could be E-learning that's mandatory, that's 20% off the job. They could be shadowing or buddying up with somebody on a ward, undertaking tasks that they wouldn't normally undertake, which is 20% off the job because they're effectively learning as they go. Of course, the time they take away from their workplace to study with their tutor, to attend teaching and learning sessions, to complete self-directed research, that is 20% off the job. So as a mandatory, we expect you to support each apprentice with attendance for their sessions every month, which typically are anything from 2 to 4 hours, depending on the cohort that they join. And of course, then there's additional prep time, research time, study time after each teaching session, as well as assessment. So typically 20% of their working month must be spent on their apprenticeship. We ask you to be involved in tripartite reviews, and by that we mean 3 people, yourself as a manager or a mentor, the tutor who's delivering the apprenticeship, and of course the learner. And these are valuable in terms of offering feedback, both from you as the employer, stroke manager, us as the training provider and the tutor, and of course the learner. So what's working well, what progress they're making, anything that they need support with specifically that you can help with, you feeding back on any change of behaviours that you've noticed or any new responsibilities that they've been given. And they typically take place every 8 to 10 weeks, and they're done online via Zoom, so you would be invited to that. You aren't required to attend every single one, but across the course of the qualification, it's really good practice that you attend some of them. And you get the opportunity to feedback too on things that may or may not be working so well for you as an employer or a manager. And that's a good opportunity to look at the individual learning plan and make changes if that's necessary. So really valuable that you do attend the 3-way reviews that we set for each learner on a one-to-one basis. And as I said, sort of every 8 to 10 weeks, and they're documented, they're recorded and uploaded to the learner's portfolio. So what does EPA stand for? So EPA is endpoint assessment. So the new apprenticeships that were sort of introduced around May 17 now involve an independent endpoint assessment organisation completing the assessment of your apprentice after we've done all of our teaching and learning. So we get them ready and then we hand them over to an independent organisation. In this case, it's Highfield Awarding, and they will undertake the endpoint assessment process with that particular apprentice. And not until they've achieved that will they be signed off for their apprenticeship. And I'll talk to you a little bit more about EPA as we go further along. So in order to get to EPA, the learner has a set of gateway requirements. And the best way to look at that really is that peer training are the driving instructors, if you like. So we're sort of taking the apprentice through their apprenticeship, and when we all deem them ready to attend their endpoint assessment, we hand them over then to in the case of a driving instructor, it would be the driving examiner. So peer are the driving instructors and Highfield Awarding would be the examiners to undertake their endpoint assessment. So the endpoint assessment for both levels, both the level 2 and level 3, is a multiple choice online test, and we ask that you support that. They'll need a quiet room. Again, they'll need an invigilator. We can provide remote invigilation, and we do. Again, as I've said previously, you can support that if you want to. And that's an online test, so they get a multiple choice set of questions and have to answer those. There is an observation of practice in the workplace. So the endpoint assessment organisation would want to visit your workplace and they would want to observe that learner undertaking everyday activities whilst always maintaining privacy and dignity and obviously the data protection and confidentiality. But they're very used to those environments and all very qualified in their field. So the observation would be of that particular apprentice undertaking their role for at least an hour. And then they would interview the apprentice straight after the observation to talk about their evidence portfolio. So across the 12 to 18 months that they're on programme, they would be gathering evidence towards a portfolio. And with your support, that evidence can be really high quality and almost certainly guarantee a higher grade. And the grading is pass, merit or distinction. So that's the endpoint assessment for both level 2 and level 3. And those 3 things can be done on the same day. So obviously what we're looking for is for you as managers, stroke mentors, to support the apprentice being released from the workplace in order to undertake their endpoint assessment. So the requirements of endpoint assessment in a little bit more detail, there is a portfolio to gather. So the tutor will be gathering that, which consists of several things over the period of time that they're on the apprenticeship. So it'd be good for you to get involved in the types of evidence that they are going to need to submit. They're going to need to write reflective statements, and the reflective statements need to be supported by good quality evidence. So a reflective statement on a day in the life of, or a situation that happened on the ward or in the theatre that they may have undertaken, supported by different kinds of evidence. Now, some of the evidence could just simply be a witness testimony, for example, or it could be a document that fully supports what the reflective account is. And in terms of primary sources of evidence for the reflective statements and the portfolio, observation and witness testimony are key. Now, what your apprentice will do is they will ask you to support that. They'll ask you to help them identify people that potentially can write an observation or potentially can write up a witness testimony. So if we look at the templates for those, so the reflective statement asks the apprentice to write about what they're going to reflect on and how they've used concepts and theories that they've been taught along the programme, by describing what happened, what did they do about it, who was involved, etc. And we ask them to write the reflective statement around a set of criteria. And the criteria is linked to the standard. So, for example, on the screen now, you'll see some of the examples of the criteria they need to cover. So communication is an obvious one. So communicating effectively with individuals. So when they write their reflective statement, they need to talk about a time when they did that. Or it could mention how they've promoted mental and physical health and well-being, how they've recognised and responded to signs of poor mental health and what they did about it. And the matrix, this document here on the screen, will help them to think about times when they can reflect on those things that have happened. And then the tutor with the apprentice will look at completing this particular checklist with links to the relevant evidence. What you can do as managers is either write observations for your apprentices on a document such as this on the screen. This is a template. Or you can ask somebody else to write an observation for them. So over the period of the qualification, towards the end, the last 3 months, really, the observations are key. We're looking for 1 or 2 observations across all the levels. You know, if we've got 2 for level 2 and 3 for level 3, that's great. And as long as it talks about what's been observed and how it links back to the criteria. So the criteria here on this matrix, whoever's writing the observation can use this matrix as a guide. So if we're to look at the top line, whoever writes the observation could say, I saw my apprentice effectively communicate with individuals by, and just talk briefly about who it was and when, without breaking any kind of data protection legislation. And then the witness testimonies are on a similar template, and or can be done verbally over Zoom with the tutor, so you can be interviewed by the tutor to basically give testimony to that particular learner, that particular apprentice's skills, knowledge and behaviours, again against that set of criteria. So to summarise your responsibilities, you do need to support and ensure the apprentice attends all the monthly sessions with the tutor. If they don't or can't for whatever reason, obviously it's going to put them on a back foot and reduce their progress. Attend on programme reviews. They must attend those reviews if you can't, but ideally if you can, that would be great, because it just makes that review so much more beneficial. And of course, you as managers then fully understand where your apprentice is at that moment in time. Support completion of a journal on OneFile which logs the 20% off the job, because that's a compliance requirement. Therefore, we do have to log that. So we're asking you to ensure they get their 20% off the job and to ensure that's effectively recorded. As I've just mentioned, supporting the gathering of evidence via observations and witness testimonies and making sure your apprentice completes their reflective accounts. And then towards the end of the apprenticeship, maybe month 12, 13, 14, depending on the level of learner, you would attend a gateway review meeting where you talk to the tutor about whether or not that learner is ready for endpoint assessment. And of course, after that, you would then allow the apprentice time to finish gathering their endpoint assessment evidence and attend endpoint assessment. So really, that's sort of the manager's role in summary. If you do have any questions, then of course you can go back to the programme leads or even peer training at info@peertraining.co.uk to ask more questions. And you will be invited to attend live sessions, information sessions. Look out for the dates which are going to be advertised on the intranet, whereby you can ask personal questions on Zoom to appropriate people to enable you to get the answers that you need. But just to summarise, those really are the manager's EPA responsibilities and on-programme responsibilities, really. So thank you very much. Hope that was really useful and look forward to speaking to you if you join one of our sessions.